Welcome, everyone. This is Gil Bash for Health Tech World. We have a very special program for you today. I'm with Dr. Kellie Stecher. Dr. Stecher has been on my radar screen for quite some time. I've written about Dr. Stecher in the past on Medical Life, and obviously Health Tech World feels very highly about the fine work of Dr. Kellie Stecher, who is a OBGYN in practice. She is in the state of, if I'm not mistaken, you're in the state of Minneapolis. Not the state of Minneapolis.
Yeah,
In
Minnesota. Yeah.
Minnesota, right? I was thinking Michigan, of course. And the reason I was thinking of Michigan is you remind me of another heroine, Dr. Mona Hanna Atisha, who was the pediatrician who really sort of called out the Flint, Michigan water scandal, very courageously stood forward, faced a tremendous amount of public pressure, and and didn't bend. And in that light, you're a bit like that for me. I mean, the work that you have done representing patients as a physician, as an OBGYN, your willingness to put yourself in uncomfortable situations to advocate for patients really represents, I think, the best of medicine, which is not just caring about a patient's medical well-being, but also their emotional well-being. And of course, I'm talking about the fact that you were concerned about a patient who felt that they had been perhaps abused, sexually abused, and you reported that out. You faced a lot of headwinds from your institution, unfairly so, and yet you didn't bend in the storm. You pressed forward and chose to go forward. So we're thrilled on the behalf of Health Tech World to have you on the program today. Someone so courageous, so dedicated to patient care. We're not going to talk all about that. I just wanted our listeners to know that you're exceptional as a physician, as a patient advocate, as a human being. I'm going to actually talk to you about what Health Tech World is fascinated about, which is something that you're fascinated about, which is patient care. It's something that drew you to medicine. It's something that, despite the rains that you faced, has kept you in medicine. And I want to speak to you a little bit about your perspective about care, about the OB part of care also, because I know a lot of OBGYNs are feeling burnt out right now, especially during the COVID period. And so I wanted to get your take on that, Kellie, if you don't mind sharing with us, what's been your experience during COVID?
It's interesting because if you look at the statistics, OBGYNs, their burnout has climbed faster than a lot of the other specialties. And I think it has to do with kind of like the onset of COVID, right? So we were kind of put to the back burner. We were told that our patients weren't high risk, even though they clearly are, right? And I think every OBGYN in the country was like, I don't know. I mean, obstetricians have to deal with the flu season and how that hits their pregnant patients a lot harder. I think all of us were very skeptical with the information that we were getting. And at the same time, we were told not to worry about it. And I think the other thing that was really challenging was we were told that we weren't frontline, right? So we were told, okay, you know what, you don't need the PPE. We're going to store that away for the ER and the ICU and all of those individuals. Our staff was also told that they didn't need to wear N95s or other PPE, even though we were seeing the information that was coming out and the huge issues that we were having with that. And it was quite a fight that a lot of us had to go through. And I remember when I was with my system, sending the emails and sending the data and sending the information, and yet our nurses weren't allowed to wear the N95s in the room with patients pushing, even though the patients had in fact tested positive for COVID, right? So I think there was this tension and this distrust, and that really built into animosity and almost resentment that just really carried through COVID. Because I think if you don't have trust in your leadership to care and to protect you, then you're not going to have trust in them to protect your patients. And that's what all of us really struggle with. And I think as you know, most physicians are really passionate about making sure that their patients and their staff are safe. And if you feel like you can't deliver on that, even though you know what the right things are, that creates that sense of moral injury. And I'll tell you, a lot of my colleagues are just completely leaving healthcare because they just can't deal with this constant tension between administration telling them what to do that's not safe for patient care.
Now, the Great Resignation obviously is impacting your profession as well. I'm thinking of all of the digital health technologies that have developed at this point, and I wanted to get your take on this because I know that you're immersed on what's good for your patients. So I'm seeing now new technologies, almost portable, consumer-oriented ultrasound devices that check sort of like fetal development. Those are going on the line more and more and more. I'm approached. I see them applying to FDA for home use. The empowered consumer, the connected consumer. I know that these data not only are visible to the pregnant woman, they're also then the data is transferred into your office. So what's your thought about the consumer, the pregnant woman, all of a sudden becoming an extension of the ultrasound in your office, the home ultrasound? What's your thoughts about that?
I think it's actually really exciting. And if you look at how health systems are run, it takes forever to actually change the policies and the format of how we're doing things. And so the innovation is going to have to start being pushed through private practice so that eventually it can be the norm. And I've seen technology looking at ultrasound and the sensitivity and specificity for predicting preterm labor. I love the whole remote monitoring stuff. I know that you have a lot of colleagues working on hypertension issues and obesity issues and things with telehealth, which I think is amazing. Because what I have found is women really don't like going to the doctor. And a lot of us kind of stop when we're done with our having kids time period, and then we just kind of let our health fall off the wayside. So I think that we have a real opportunity to change maternal mortality and morbidity. And I think we really need to look at how we're using these resources for rural healthcare, because again, kind of tying this back into the Great Resignation, 1 in 3 physicians that perform rural healthcare are looking at leaving, right? And so we're going to have these deserts that get bigger in the rural areas. And so if we don't have the technology and remote monitoring, then the maternal mortality and morbidity is going to go up even more significantly. But I really think that we as physicians are going to have to push for the innovation to actually be incorporated into health systems, because again, they don't like change, even if it's better for patients, even if it's more cost effective. There's a number of things that I tried to get implemented just to work on physician burnout in my system, and that didn't have compelling value for our system. Even looking at physician suicide and how we can use technology to work on that, and even artificial intelligence. And they chose that was not an issue that they wanted to delve into. And so we have all of these things. However, if we're not allowed to use them, it really is quite frustrating. And so I'm hoping that we can kind of slowly sneak these things into mainstream.
You've touched on a whole gamut of issues, and I just would sum that up to what my friend John Nost often says: culture crushes innovation. And the culture of medical institutions often is rooted deep. It is almost sometimes immovable. So I do want to deal with this whole aspect of maternal mortality that you talked about, because that's almost in many cases the untech conversation. It's not that we need more tech to deal with maternal mortality. In many cases, we need access to care, and we need heightened awareness of what's going on. I don't think our listeners realize that, sadly, America, this great nation, one of the most developed nations certainly in the world, and one of the most prosperous, is also home to one of the highest statistical rates of maternal mortality in the world. Now, of course, that's by zip code, and that's tragic. Could you spend a few more moments talking about that? Because I don't think that we really think of maternal mortality in this nation as a risk. Could you actually pinpoint for people who are joining us, what are the risk factors, and perhaps even where are those risk factors?
Yeah, I mean, it's really alarming because a lot of maternal mortality is due to racism. And I don't think that seeing what has gone on in the last couple of years, this should shock anyone. And being in Minnesota, being in Minneapolis, being at the epicenter of where George Floyd was murdered, I obviously had a different perspective on everything that was going on because this was only moments from where I worked. For a long time, I had military lining the highways on the way going into the hospital. And I think that a lot of what was going on was completely misrepresented for political gain, which I think is really unfortunate because all these things were public health issues. The virus, racism, all that, none of that should be politicized. It should just be something that we take care of as physicians and public health advocates. And when we look at the statistics, Black women die at a rate of 3 to 1 to white women. And in some areas in the country, it's more like 5 to 1. And I know New York State actually put out data. And at one time in the last couple of years, it was a 5 to 1 Black to white. And that is really significantly alarming because all that is racism then. And if you look at the mental health crisis we really have to count postpartum depression leading to suicide. We have to count that as part of maternal mortality as well. We don't have resources to deal with that. We don't have the resources to deal with monitoring hypertension and other issues related to pregnancy in the postpartum period. And we see death from that as well. And so not only is it a race divide, we see lack of resources and lack of care for women, especially in the postpartum period. It's like, and we see this with a lot of other issues in terms of reproductive rights right now. It all kind of goes hand in hand, but we care about the woman as much as you're an incubator for this child. And then once that is done, then a lot of those resources fall off. And if you are on government mandated insurance because you're pregnant, you're not going to have the access to care that you need postpartum either. So all of it really goes hand in hand. But I think it is interesting that we see the mother as an incubator for this fetus and don't provide her with the care that she needs long term.
Yeah, it's you're touching on some of the most pressing public health issues that we're facing right now in terms of perspective. Bringing life into the world is a treasure. It's an awesome responsibility, and the responsibility doesn't stop with the parents, the mother. It includes obviously our system. And if we're going to look at changing constitutional law, the same people who are advocating for that also have a responsibility to take a look at the implications of that. And I don't know if you were affected about this. I was sort of amazed when the benefits for children chip was under discussion. The same people who bring that under discussion and say, well, should we continue to provide benefits for children for healthcare in the Medicaid situation? Let's ignore it over here and ignore it over here. And I was curious, as a clinician who is also bringing life into the world, not so much your political perspective, but your medical perspective of when that you're sort of ushering into the world a new life, as a physician, and clearly more as a physician. You're a parent yourself, but what really comes across is your humanity. Do you worry about what's going to happen to those mothers and those children after a successful birth? When you walk out, you take off those gloves, you take off the gown, and you're on to the next to do on your list?
Yeah, I mean, I think that's why I do what I do, right? I think that's why you do what you do, is we worry about the world we're leaving for not just our families, but for everyone's family. And it's really so fascinating because when we look at empowering women and making sure that they're healthy and making sure that they have a successful life and can work and all these things, and then you look at kind of the things that are going on in the country right now, they are directly opposed to each other. because as a physician, have I been put in situations where we've had live ectopic pregnancies at 6.5, 7 weeks with a heartbeat? Absolutely. But that baby has no ability to survive and the mother will die. And so either both of them will die or we can save the mother. So in that moment, doing a termination is pro-life, right? And so I think that we've lost sight that we're all human beings and we all need resources to thrive. And if you look at the determinants of health, how you grow up, and if you've been exposed to abuse, and if you've had, there's a whole staging system for this. You're more likely to have mental health issues or different things down the road, or diabetes or chronic illnesses, if we don't take care of things at the forefront. And if we take away resources from mothers and children now, we're going to be paying for this on the other side of it in the healthcare system. And so I think that a lot of what we've chosen to do is so short-sighted. And if we just actually embrace our humanity and realize that people have needs and we should be taking care of them, then we actually will prevent these issues from happening 20, 30 years from now. So I think that we're definitely trying to maybe save a couple cents now, which could pay off in the millions later. And that's so frustrating because these people could have a really healthy, successful life if we actually help. And I mean, when I think about the things that I've gone through in my life and, resources that I wish that I would have had, when I was a teenager, I was sexually assaulted and I actually went and got free counseling. And I drove myself and I went there. And the fact that I was able to go to, I actually think it was what was it? The Big Brothers Club or whatever. So one of the clubs in town, they offered however many free counseling sessions. And so I knew that. I looked up in the yellow pages because we didn't have, smartphones then, and went and got resources for myself. And it's interesting because who's going to even know that those resources exist? Who's going to pay for them? Who's going to have access to them? If I hadn't had some sort of support, like what would I have thought about me or my potential going forward? It's interesting thinking about where we can go two different ways. And I feel like we always choose the wrong path, unfortunately.
So I wanted to ask you, I mean, we're touching on so many critical aspects of the medical profession and public health right now. And you talked earlier about the role that technology can play to support, I'll call it forward-thinking health professionals. We talked a little bit of, you mentioned AI to take a look into the future of people at risk. We talked about, in essence, digital health for scheduling. We talked a bit about sort of handheld consumer-oriented technology to connect clinicians with their patients around fetal health. We talked about remote patient monitoring. What are the technologies that are on your radar screen that you either wish you had access to or you personally are using in your clinical practice that you think our visitors today should know more about?
It's interesting because I've had the opportunity to now work in multiple different systems in the last couple months because I'm trying to expand my horizons. And when I go to more rural areas, I would love to have better access for telemedicine because there's so much that we could do for follow-up. However, a lot of these areas are very stuck in what was and trying to reclaim how medicine was before the pandemic, right? So if you look at resources, especially in those areas, there's not enough OBGYNs to cover. We really need more access to blood pressure monitoring, diabetes monitoring, weight loss programs. I know one of your colleagues also is working on obesity medicine and doing that telemedicine wise. And so we need these resources for people to be able to access quickly and easily. And I think as someone who has personally lost 150 pounds,
Congratulations.
Thanks. I mean, it's like this, right? Like anyone who's
But that's a real achievement. That's a super achievement.
We all have our own struggles, right? And I think once you've struggled with weight, it's, that's kind of your drug of choice, right? And so I think if you don't have access to these things and have a connection with somebody, you're not going to be successful. And so I think that we really need to create better programs for people to follow up. We need to be able to have people have access to a clinician right away. And that's one of the things that I'm hoping on to work with Offer Health, which is also another organization that's going to be focusing on women's health and access in rural America. Because again, the deserts of care are really important to overcome. And so having those resources handy for people, I think, is really critical. The mental health stuff is really a challenge, as you know, and that's one of the big reasons I started Patient Care Heroes initially, is to help our healthcare workers get mental health access. What's interesting about that is, and you probably know this just as well as I do, but clinicians are fearful to seek resources for mental health care. And that can play back on their credentialing or their licensing or any of those things. And when you talk to people in other countries, they're actually quite shocked that that is even a thing here. And so I think making sure that we have, again, artificial intelligence is kind of nice for people who don't want to go in and seek care for their alcohol abuse or their depression care. However, as we've seen with other companies just kind of handing out medications, and we've all seen that in the media recently, we need actual clinicians at the head of this to make sure that people aren't just, medicating and going forward, right? So in theory, some of this stuff I think is going to be amazing, but in the mental health world, I think we need to focus more on that connection, because otherwise we're going to lose people and we're going to have higher rates of suicide because people are having this false sense of security with things like the artificial intelligence for depression. So I think there's a really there's a narrow road to walk with that particular item, unfortunately.
You have a history of heroism, and it starts. I think that people obviously look at recent events where you were willing to step forward to protect a patient's well-being and weather that storm. But you're creating advocacy organizations for clinicians. You're sharing with us today a bit about your own background, having been assaulted as a young person, having gone through that, bringing it forward, not suppressing it, rather channeling that to good and purpose is beyond impressive. Your willingness to look openly at where the system is strong and where the system is in need of healing itself, how technology can play a role in that. Your look at rural America, which I think often people neglect to recognize that the health of rural America is vastly different than the health of urban or urban prosperous America. You're putting it bluntly out there that a lot of the morbidity and mortality that we face in health disparities is the underlying symptom is racism. Nothing more, nothing less. Systematic racism built into the system. And we shouldn't be embarrassed about talking about it. And you're not.
No.
You have to acknowledge it and become more aware of it in order to affect change in the system. And you're an advocate for that as well. What are you not doing that you're willing to share with us today? Because you're boldly advocating for people's emotional and medical health. You're advocating for your patients. You're advocating for your colleagues. You're advocating for people in rural areas of the nation. You're advocating for us to take a close look within ourselves on our own behaviors, our own biases that inhibit people's well-being. You're looking at technologies to deploy. So there must be, Dr. Stecher, something that's going on right now in your mind that you haven't shared with us yet. Tell us.
Oh gosh, I mean, maybe I should be a better advocate for myself.
On Medica, I just published words from my father-in-law, who passed away, 97-year-old physician, who was both an internist in infectious disease and psychiatrist, and one of the founders of sports psychology. And one of the awesome tasks of a family is to go through the departed's possessions. And in it, my wife found a very touching statement he had written to his graduate students about self-care. And in it, he talks about, I won't go through the details, he talks about there are so many choices: fun, happiness, work, family, extracurricular activities. He said, they're all great. The challenge is being mindful of why you're doing what you're doing when you're doing in order to take care of yourself. And I think that you're doing so much with mindfulness that your thought about taking better care of yourself, I find amusing more than you did, because I think you're passionate about all of these things with equal power. But there must be the next great adventure of Dr. Kellie Stecher that is on the horizon, and I want to know about it because I want to be watching for it. What's the next big thing?
You know, it's interesting. I was in practice for 10 years and my patients were my world. And sorry, I'm like emotional about this. Um, and when I was fired, which was a really sobering thing, you really realize just how replaceable you are in this system. And I want to make sure that we're helping other people who are mistreated or harassed or bullied or discriminated against, especially physicians, because I've been told, that this obviously what happened to me is not an anomaly. This is something that goes on every day across the country. And so I'm hoping that my experiences can set a precedent for other people to point at and go, okay, this girl in Minnesota, she somehow did this and I can do it too. And I've been told by a number of people that they're actually glad that this scenario happened to me, because I have the connections and I have the people and I have, a great legal team because of the advocacy work that I do. And a lot of people don't have those resources. If I'm an ultrasound tech and I'm being sexually harassed or bullied, do you think I'm going to come forward? No, because my whole career is going to be over, right? And I'm not going to be able to pay for an attorney and they're not going to take it on to contingency and all these things. And so my goal is to use this to help people move the needle forward to protect people against the sexism and racism that is so prevalent in healthcare. And something that I was working on before this whole thing happened was creating the ability to have safe reporting structures for people. And I'm working with Speak Up Ortho and Physician Just Equity and these other organizations. And hopefully we can create apps where, especially our med students and residents who are the most vulnerable to these things, can go on and actually be able to see what they need to do in terms of next steps. And I know that there's a lot of things out there, just we have not been very organized as a profession. And so people feel very alone and isolated when these things happen. And honestly, it is a very isolating situation, because when you're speaking up for something, even though it is the right thing, you are kind of seen a little bit as a leper, right? And so all those support people that you had within a system or something else, they just kind of disappear, right? Because, oh gosh, is this going to be a legal thing? Is this like, what's the situation? So there's this fear that kind of circles you then, right? So even if you're the best person in the whole world, you now are instilling fear in people that used to be your best friends, right? And so we're trying to create systems where people can protect themselves and have a sense of community so that they're not out there just feeling like they're dangling in the wind. So that's definitely one of the big projects that we're working on.
We're going to be watching. I just want to recount for our listeners today some of the amazing things that we've heard, almost movie-like, I might say. This is I guess this is sort of like Top Gun Maverick, the preview on Health Tech World of the life of Dr. Kellie Stecher. You're an advocate for patients. You're an advocate for mental health awareness. You're an advocate for racial equity. You're an advocate for health technology. You're an advocate for safe workplaces. You're an advocate for the health of rural America. And you're mindful that you need to be an advocate for yourself, for your own well-being, which is part of self-care. And that's a lesson that I think all of us should take away from this too. Dr. Kellie Stecher, I want to thank you for joining us today on Health Tech World. You're inspiring. We've been watching you long before your adventure, your career adventure, which is consistent, I think, with your lifelong journey. It is not an anomaly. Courage is not something you have to dig down deep to find. It is part of your fabric. I want to thank you for inspiring us today on this program. We're going to continue to be in touch. We're going to continue to watch closely. I urge all Health Tech World readers, listeners to follow Dr. Stecher on Twitter and on LinkedIn. Show your support, show your interest. You will be better for it. Thank you all.